Hey everybody, Dr. Anderson here, plastic surgeon at Impressions. Thanks for coming to our Sculpted Summer webinar. We're really excited to have everybody here. I'm going to talk about a couple different procedures that I specialize in that we can do right now to get you ready for the summer. There's going to be a Q&A session after this, so please stick around. All right, so the first procedure that I specialize in to get you guys ready for summer is a breast lift or augmentation. Occasionally, these can be done together as well if you need to add volume and also lift the breast. So, what is a lift and what is a breast augmentation? Breast augmentation is the simplest procedure we have to give an instant amount of volume using a small to moderately sized implant. My whole aesthetics for my practice is natural, refined, customized results. We want you to look you, but just a little bit enhanced. So I don't do those crazy, wild breast augmentations that you guys see in tabloids or sometimes on celebrities, but I do love a super natural dual plane breast augmentation. Perfect way to give someone a nice boost in volume, a nice enhancement to their confidence, and really get them ready for summer. So downtime for this is a couple weeks. You can get back to work in about 1 week though. And then I just have you be really careful about lifting restrictions after surgery. So no lifting more than 10 pounds for 4 to 6 weeks after surgery. In terms of what you need to wear to recover from this procedure, the only item is a customized surgical bra. This is something that we fit you for and you receive on the day of surgery, and is a relatively straightforward recovery. Doesn't require a lot of intensive garments. Secondary to that would be a breast lift. So if you're splitting this up from an augmentation, a breast lift just involves removing a lot of the extra skin from the breast, as well as lifting that nipple and areola complex up above the fold of the breast. This restores youth and lifts the breast up from resting on the upper portion of the abdomen, which is pretty transformational in a lot of people. Recovery from this is also very straightforward. It involves just wearing your customized surgical post-op bra. Overall, both of these breast procedures are really, really well tolerated, and the recovery is very straightforward from these. Not a lot of crazy garments, and really just that lifting restriction. All right, my second procedure that I specialize in to get you ready before summer is localized liposuction to a stubborn area. A lot of times these stubborn areas are genetically predispositioned, so like the love handle area or that bra fat roll on the side, sometimes some small areas of the thigh, maybe middle of the thigh, or that banana roll back there. Also, if this stubborn area has a little bit of extra skin and extra fat, there are tools I can use to help tighten the skin surgically. The best gold standard for surgical skin tightening is called Renuvion. This harnesses the power of radiofrequency energy and helium plasma that combine together, really heats those collagen fibers and helps the skin snap back and really tighten up. This is an incredible transformational technology that I use in probably at least half of my liposuction cases. Really allows me to get my patients the best result after surgery. The last procedure that I have to get you ready for summer is a Skinny BBL. This is such a transformational operation. Why? Because it's kind of two operations in one. You get really amazingly customized high definition liposuction to however many areas of the body that you would like to treat. We take that tissue off, we take that fat, and process it down to only the healthiest fat from that. We use that to transfer some fat into hip dips or overall projection of butt and hips to really get you a super smooth, contoured result, really ready for bikini season. So this is such an amazing operation because it's not like the Miami BBLs that we all think of when we hear Kardashian, BBL, things like that. This is expertly tailored and precisely performed to really treat those targeted areas like the hip dips and overall projection. So the results are super subtle, but just because it's subtle doesn't mean it's not impactful. And why come and see us? We have some of the best plastic surgeons in the world. We also run our practice as a concierge plastic surgery service. Our patients get the most highest quality care. We offer a partnership with a hotel next door. We get 20% off for all of our patients, whether they're from in town or out of town. If you're an out of town patient, we offer a flight credit. We will buy your flight to come have surgery with us. And on top of all that, we have a quad A, fully accredited operating rooms in our office. Pretty incredible to treat patients in our office, do all of your follow-ups, all of your recovery, if you need hyperbaric oxygen, and also you can stay across the street. We've really thought of everything for our patients. Thanks for listening, everybody, and stick around for the Q&A after. 5 people are going to win a free hyperbaric oxygen treatment. Thanks, everybody. Hi, everybody. I want to start the Q&A session. So if anybody has any questions, go ahead and use the chat or the Q&A button. So to get things started off, I just want to say thanks everybody for coming as well. Hopefully it was pretty informative. I tried to do highlight a couple of procedures that we can get done for you pretty quickly and get everybody ready for summer. So thanks. Take a look at this. All right, first question is, do you still offer Sculptra as a non-surgical option for body contouring? Yeah, Sculptra is a great option for a non-surgical treatment to the hip dips or a very modest augmentation to the overall projection of the butt. We do have another biostimulator called Radiesse as well. Sometimes that can give a little bit more projection. Sculptra is really, really good with enhancing skin quality, treating cellulite, things with that. The one downside, so the positive to that is there's hardly any downtime at all. You can get those injections, you can go right back to work, right back to physical activity, all that stuff right away. There's no sitting restrictions for those 2 products either. And yeah, they're pretty great. All right, the next question is, can men consider gynecomastia treatment right now to be ready for summer? Yeah, that's a great operation to get ready for summer. The chest is always a sensitive area for some guys that have a little bit of extra tissue there. Really, the key for gynecomastia treatment is first the correct diagnosis to make sure that gynecomastia is what you actually have. Gynecomastia is a little bit of breast tissue. So the breast tissue is a little bit more fibrous than just fat that's normal fat that's just under the skin. So it really takes a dual approach to treat gynecomastia appropriately. That dual approach involves chest liposuction to really contour the whole chest of the patient, as well as to actually excise a little bit of that gland that sits just underneath the areola. And you really have to do both of those things to get the best treatment for gynecomastia and get that chest ready for the summer. Another question. Oh, this is really good. So it's about the hyperbaric oxygen chamber. So some people call it a hyperbaric tank as well. This is literally like a big tank that's in our office. You get inside, and it's a procedure that super infuses the air and your body with extra oxygen. So it's really, really good for, like, athletes use it, people that are really into fitness and wellness, as well as pre-op and post-op patients to help recover from their surgery. So really, really can enhance and speed up your recovery. Sometimes, depending on what surgery you have, you can do a treatment or 2 before surgery, and then a package of usually 3 treatments after surgery really expedites your recovery, speeds your healing, and gets you back to being active a lot faster.
Check out the question for Brittany.
Okay, we have a question about how much fat survives in a skinny BBL, and how do you separate good fat from the bad fat? That's a really good question. So when I do liposuction, I harvest a bunch of tissue from under the skin. The fat layer is comprised of two separate parts. So the first layer is a fibrous septal network, which is like scaffolding. And then within that fibrous septal network, within that scaffolding are the actual like yellow golden fat cells that people characteristically think about. So I separate that fibrous tissue from the really healthy golden healthy fat, and then I only graft the healthiest fat from that. So then when I have all the best fat from that process, I graft that to the body. Industry standard is about 60% of whatever I graft will survive. That'll survive forever. And 40% will get reabsorbed by your body. So the really, really cool part about a fat transfer or a BBL is that that 60% survives forever. So you don't need like a BBL every 5 years or something like that. It survives forever. The bad part is 40% of that is lost. So there are a couple of things that we do to optimize those results to kind of get a little bit higher percentage survival. Hyperbaric oxygen is one of them. So that's something that can really stimulate the blood supply process to that new fat transfer and can push that up to 70, maybe even 80% as well. So that's been a pretty recent development in the post-op care for skinny BBLs. That was a great question. Okay, we have another question. With summer coming, what tips do you have for scar recovery to make sure scars don't pigment too much in the sun? That's an awesome question. So yeah, sun's coming. Any UV radiation can negatively impact your scar. So usually right after a surgery or any kind of trauma that happens to your body, you get a scar and it turns a little pink or red. That's a totally normal color within the scar maturation process. So that takes about 10 months for a scar to totally mature. You know when it's totally mature because it turns white. So the ideal scar you want is a thin, flat, white line. When it's thin, flat, and white, then you know it's fully matured. So within that process, while your scar is still reddish to pinkish, that means it's still maturing and it's susceptible to change. So that's susceptible to good change or bad change. So UV light will cause your scar to raise and redden, possibly like forever. So how do you prevent that from happening? So SPF is our first defense. Lots and lots of SPF over your scars until it matures. Cover it up too. If you're outside, make sure you cover up your scars. Try to avoid the sun within reason, depending on where the scar location is in your body, and also use silicone scar therapy and also scar massage. So those are all the things that are evidence-based medicine proved to enhance the aesthetic appearance of your scars. Okay, another question. Next question is, do you perform mini arm lifts, and where is the scar in the armpit? That's a really good question too. Yes, I do body lifts, arm lifts, thigh lifts, all that stuff. For the right patient, a mini arm lift is fantastic. So usually that involves some contouring liposuction to the upper arm, depending on how much skin needs to come off. And then I hide that incision kind of right in the armpit. So it's a little vertical incision that goes right in the armpit and totally hidden, especially when you have your arms at your side like that. That's an incredible operation for the right patient. But the key is it has to be the right patient. So that patient can't have too much skin. It's just a small to moderate amount of skin. And then we do that liposuction. I can even use Renuvion to that, which is that skin tightening device that I mentioned within the webinar. And using all that technology together really provides a great outcome and a really small incision. All right. I think that's all the questions we have. Thanks everybody for coming. I really appreciate the support. If you have any other questions, you can always reach out to us. Do they have like an email or anything?
Yafa.
Oh yeah. Yeah, my surgical coordinator, Yafa, you can reach out. We'll see if we can drop that email somewhere. Always happy to jump on a call and answer any questions with anybody. One more question. How long does it take for Renuvion to show? So right at the time of surgery, I can actually see skin tightening of the collagen fibers network under the skin, which is really, really incredible. So you do get a certain percentage of skin tightening right at the time of surgery. I probably see 20, 30%, something like that. And then over the course of 6 to 9 to 12 months, you get increased skin tightening after that. So that really is a great technology, and it's all about the recovery. It's not just right after surgery too. So you get a little bit of benefit right after surgery, but the true benefit is, 3 to 6 months after surgery. Oh, and do you have to do it more than once? Yeah, so that's a follow-up question to the Renuvion question. So Renuvion is such an insanely powerful technology. I recommend it like once every 10 years or something like that. So depends on the area of the body, depends on the patient's age, things like that. If we use Renuvion on a younger patient, we really get a lot of skin tightening, and they might not need something again for the rest of their life for 20 years or something like that. So depends on the patient exactly, but yeah, it's a very powerful treatment. It is surgical skin tightening. It is not a non-surgical device. So yeah, so a lot of these questions too, I talk about on my Instagram account. A lot of before and afters I show, and videos, kind of behind the scenes OR stuff. So be sure to follow me on Instagram. It's at dr.eric.w.anderson, dr.eric.w.anderson. So once again, thanks everybody for coming. We'll see if we can post this webinar somewhere, like on YouTube maybe, if you guys want to reference it for the answers of the questions. So, all right, thanks everybody. Have a good night.